Welcome to Oral Health Care and the Special Needs Child. According to the National Maternal and Child Oral Health Resource Center, dental care is the leading unmet healthcare need among children with special needs. Why is oral health important? Like other areas of the body, the mouth teems with bacteria, mostly harmless. But the mouth is the entry point to the digestive and respiratory tracts, and some of these bacteria can cause disease. Normally, the body's natural defenses and good oral health care, such as daily brushing and flossing, keep bacteria under control. However, without proper oral hygiene, bacteria can reach levels that might lead to oral infections such as tooth decay and gum disease. Also, certain medications, such as decongestants, antihistamines, painkillers, diuretics, and antidepressants, can reduce saliva flow. Saliva washes away food and neutralizes acids produced by bacteria in the mouth, helping to protect you from microbes that multiply and lead to disease. According to the Academy of General Dentistry, there is a relationship between gum disease and health complications such as a stroke and heart disease. Other research shows that more than 90% of all systemic diseases involving many organs or the whole body, have oral manifestations, including swollen gums, mouth ulcers, dry mouth, and excessive gum problems. Such diseases include diabetes, leukemia, oral cancer, pancreatic cancer, heart disease, and kidney disease. Oral health is essential to overall health. Good oral health improves a person's ability to speak, smile, smell, taste, touch, chew, swallow, and make facial expressions to show feelings and emotions. Please take a moment and review the problems that could occur if there is poor dental health. Why are special needs children at higher risk? Common oral problems, such as tooth decay or gum disease, affect all children. But children with disabilities and other special needs have more oral health problems than the general population. For example, children with disabilities may have impaired cognitive abilities, behavioral problems, impaired mobility, neuromuscular problems, drooling, gagging, and swallowing problems, uncontrolled body movements, gastroesophageal reflux, or seizures. These complications can be barriers to adequate oral health care and put them at higher risk for developing oral health problems. What causes oral health problems in children with disabilities? Some contributing factors to poor oral health in children with disabilities and other special needs will be discussed on the following slides. Why are children with disabilities at higher risk? Oral conditions. Some genetic disorders in young children can cause defects in tooth enamel, missing teeth, and teeth that do not align properly. Children with Down syndrome often suffer from gum disease. Physical limitations. Children who cannot chew or move their tongues properly do not benefit from the natural cleaning action of the tongue, cheek, and lip muscles. Why are children with special needs at higher risk? Reduced saliva flow. Children who need help drinking may drink less fluid than other children and may not have enough saliva in their mouth to help wash away food particles. Difficulty brushing and flossing. Children with poor motor coordination, such as spinal cord injuries, muscular dystrophy, or cerebral palsy, may not be able to clean their own teeth or use the usual brushing and flossing methods. Why are children with special needs at higher risk? Medications. Children using sweetened medications for a long time can get tooth decay. Some anti-seizure medications may cause swelling or bleeding in the gums. Restricted diets. Children who have difficulty chewing and swallowing may often eat pureed food, which may stick to their teeth. In the following slides, we will talk about specific disorders and helpful hints for toothbrushing. Oral care and Down syndrome. People with Down syndrome may present with mental and physical challenges that have implications for oral care. Although the mental capability of people with Down syndrome varies widely, many have mild or moderate intellectual disability that limits their ability to learn, communicate, and adapt to their environment. Language development is often delayed or impaired in people with Down syndrome. They understand more than they can verbalize. Also, ordinary activities of daily living and understanding the behavior of others as well as their own can present challenges. Oral care and Down syndrome. Provide oral care in an environment with few distractions. Try to reduce unnecessary sights, sounds, or other stimuli that might make it difficult for your patient to cooperate. Many people with Down syndrome, however, enjoy music and may be comforted by hearing it in the dental office or during toothbrushing. Use simple, concrete instructions and repeat them often to compensate for any short-term memory problems. Comfort people who resist oral care. Reward cooperative behavior with compliments. Oral health and autism. Oral health is a very important component of healthy daily living, but for some children with autism, oral health habits can be challenging. First, you should pick out the right toothbrush. There are many colors, styles, and types available. It is important that the brush is the right size for the child's mouth and that it has soft bristles. For some children with autism, brushing teeth can be difficult. The sensation can be uncomfortable at first, and the child may need to be desensitized. You may want to start by using the toothbrush to touch the child's lips or just inside the mouth. You may also want to teach the child to open wide so that this direction is understood. Showing the child how you brush your own teeth may also be helpful. Oral health and autism. Brushing your child's teeth. Stand behind your child with their head on your chest. Put a pea-sized amount of toothpaste on the center of the brush. Guide the brush as if you were brushing your own teeth. There are 6 steps to brushing. Brush the outside, inside, and tops of the bottom back teeth on one side of the mouth 5 times. Move up and brush the inside, outside, and chewing surfaces of the top teeth 5 times. Brush the bottom front teeth outside and inside 5 times. Move to the opposite side and brush the bottom teeth outside and inside 5 times. Brush the top front teeth inside, outside, and chewing surfaces 5 times. And brush the opposite top back teeth inside, outside, and chewing surfaces 5 times. Oral health and cerebral palsy. CP is a common chronic motor disorder with associated cognitive, communicative, and seizure disorders. Children with CP have a higher risk of dental problems that can further affect well-being and quality of life. Providing adequate oral care requires adaptation of special dental skills to help manage the ongoing health issues that may arise. As oral health is increasingly recognized as a foundation for general well-being, caregivers for CP patients should be considered as important components of their oral health. Oral health and CP. Home dental care and hygiene should be promoted from early on. Parents and nurses should start gently daily cleansing of the incisors with a soft cloth or an infant soft toothbrush. For older children who are unwilling or physically unable to cooperate, the child can be placed in the caregiver's lap to stabilize the head with one hand while using the other hand to brush the teeth. An older child may recline on a chair or bed with the head backward with the caregiver's hand stabilizing the head while the teeth are brushed with the caregiver's other hand. The patient's hands may have to be held by a second person for effective oral cleaning. To encourage independence of children with milder motor disabilities, an electric toothbrush may be utilized effectively. Please take a minute to review the possible positions for brushing teeth of special needs children with cerebral palsy. Oral health and epilepsy and seizures. Epileptic children are liable to experience oral health problems either due to the disease itself or medications administered to control the condition. Epileptic children are highly burdened with gingival problems and liable to develop dental caries, especially in primary teeth. Oral traumatic injuries, however, are not common complications if seizures attacks are well controlled. Epilepsy and oral health. The seizures, often associated with epileptic seizures, can cause many dental issues, including bites to the tongue or cheek, chipped or cracked teeth, displacement of a tooth from the socket, trauma-induced TMJ, or a fractured jaw. Oral health and seizures. Unfortunately, many of the medications used to regulate seizures can cause other oral health problems, such as bleeding gums, overgrown gums, and even swelling of the tongue and ulcerations due to a B12 deficiency. These same drugs can also impact absorption of vitamin D, a mineral that helps strengthen teeth and bones. The best way to combat these issues is to practice excellent oral hygiene, including regular visits to the dentist. When visiting the dentist, make sure your dentist knows about your epilepsy and your medical history. G-tube feeding, caring for the mouth and teeth. Good mouth care is very important for all persons who are fed with a tube. Even if a person is not able to eat or drink food through the mouth, they still need to have their mouth and teeth cleaned twice a day. Brush the child's teeth, gums, and tongue twice daily. The child's lips should be moistened with water and, if necessary, petroleum jelly to prevent cracking. Oral care for the trach or vented patient. Supplies you'll need: a pediatric toothbrush, toothpaste, single use only, toothettes if possible, plastic medicine cups, oral mouth suction, and gloves and a face mask if possible. Oral care of the trach and vented patient. Intubated patients are unable to maintain normal oral care and hygiene. Accumulation of bacteria in the mouth can change the bacterial flora. Oral secretions can be aspirated during intubation, even with intact endotracheal tube cuffs. Aspiration of oral secretions is associated with increased risk for ventilator-associated pneumonia. Toothbrushing loosens bacteria and enhances the ability to reduce the number of oral pathogens. Suctioning and the ventilated patient. Prior to beginning oral care protocols on ventilated patients, and immediately following oral care, it is important to suction the patient's mouth and the subglottic space in order to prevent aspiration of pooled secretions. Suctioning should be repeated as needed during oral care. Toothbrushing technique for ventilated patients. Use a systematic sequence. Angle the bristles toward the gum line and brush with gentle pressure in small circular strokes on each tooth. The bristles of the toothbrush will extend underneath the gum line if adapted correctly. Brush the tongue with a long outward sweeping strokes. Gently move the tube from side to side as necessary for access. Suction as needed throughout the procedure. What is the correct way to brush children's teeth? Aim the toothbrush at a 45-degree angle towards the gum line. Use a pea-sized amount of toothpaste. Use a gentle circular motion. Repeat on the inside surfaces. Use a light back and forth motion on the chewing surfaces. Spit or suction out the toothpaste after brushing. Please take a moment to review the 6 steps for brushing your child's teeth. Here are some tips to make brushing a special needs child's teeth easier. Brush the child's teeth with your child lying down. Put the child's head on your lap or on the floor, keeping his head steady with your legs. If the child is standing, have his back to you with his head tilted slightly and resting against your body. Have the child stand in front of the bathroom mirror while you brush his teeth so they can see what is being done. When brushing teeth, allow him to choose which toothbrush he wants to use. This will help motivate him to brush. If they are able, let him brush his own teeth first. Then you should brush them again. Encourage the child to spit out the toothpaste after brushing. Keep in mind that most children's toothpaste brands are fluoridated. You should only use a very small amount, a smear of toothpaste on the head of the toothbrush. Swallowing too much toothpaste with fluoride can lead to staining of the teeth, called fluorosis. Poor oral health puts kids with special needs at risk. For more information or more handouts to accompany this presentation, please copy and paste the Google Drive link below. Certificates of completion. Please go to the link in the comments and/or the video description for a short quiz and a certificate of completion. Thank you for participating.